This is Idaho News 6.
COVID-19 testing facilities across the country, as well as here in Idaho, have seen a shortage in parts for the testing process.
Idaho News 6 reporter NICOLE CAMARDA explains what health officials really mean when talking about a shortage of tests.
There's a shortage of tests nationwide and in Idaho.
Hospitals and other testing facilities are running low on tests, but probably not in the way that you think.
Back in the day when you couldn't get swabs, right? So a lot of times I think people think maybe when we say that they were having a shortage of tests, people think that. There's really three pieces to limiting factors when it comes to COVID testing.
Think about it as a chair, but with only 3 legs, off balance. Your first leg is going to be your supplies, your second leg is going to be your lab capacity, and your third leg is going to be where people are physically getting tested.
I would say that this shortage of testing supplies is worsening. The supply chains that the laboratories use are unstable, and a lot of the national laboratories that are out of state are also at capacity.
Crush the Curve sends their tests out of state for results, which could impact turnaround time in getting results if other states are using the same labs.
Even if you had all the chemical reagents known to man, like what's the total throughput that lab could do that you're interfaced with? And do you have to share it with other hospitals, for example? So like if I'm using a big commercial lab and so is New York City and Houston, Texas, and everything else, I'm going to feel that.
So far, Crush the Curve says they've noticed some longer wait times for results over the last few weeks.
Results are probably delayed by about 12 to 18 hours longer than we saw, call it 2 weeks ago.
Even though it would be great to have unlimited testing capacity with rapid turnaround time, we don't have that right now.
NICOLE CAMARDA, Idaho News 6.
Health officials continue to urge everyone to wear masks, social distance, and stay home and self-isolate if you have symptoms of the coronavirus.